Life on the streets is not conducive to good health, and so the likelihood of developing things like asthma, diabetes, AIDS is much, much higher among the homeless population generally, and especially among the chronically homeless population. So it really is a health issue to try to find permanent housing for people who, if they end up off and on the street, are likely to be that much more at risk of developing all kinds of health problems. We know that the conditions of homeless people are not going to foster their independence. They will continue to perpetuate their dependence on the kinds of services, social services, health services, and the criminal justice system. The idea is that if you in fact have somebody who has a roof over his or her head and the availability of services to use, it becomes a preventive measure rather than a palliative. People who have a stable residence do better in a whole variety of areas. I think that there is a problem of perception that needs to be addressed head on versus the reality. People are often fearful that if homeless individuals move into their neighborhood, that property values will go down, their neighborhood will in fact be perceived as not as desirable as others, and there has been research done that indicates that there is not any appreciable decline in property values, that in fact in areas where the property values have been rising, as they have in Worcester until very recently, they continue to rise.